Give me an example. Let's look something up.
So now that the referencing is on, just ask it, tell me about ultrasound and ANTT or what would be some kind of new information you might need to glean from that.
Now, this has probably going to pull a lot, so it might not. Tell me about the ultrasound. So this is an extremely generic question. Even when you're talking to a person, you're going to have to pivot the conversation every once in a while.
Right. And so if you look back in your message that you said to ask about, we can see the actual references that were pulled, the page numbers, so page 75, S75 from the INS, and that is about
Oh,
vascular
cool.
visualization. And then all of those are going to be the most relevant to ultrasound and IV insertion.
Okay, so you're saying it's pulling it created a response based on these 1, 2, 3, 4, 5 pages.
Correct.
Okay.
And
And it
so
gives you
now,
literal pages.
so now with that in, you can turn referencing off.
Okay, so I'm going to turn that button off. Now it's red. And then
And so now you
what
can say, write me a policy for my VAT or my unit, write me a policy for my unit to follow.
5 step, let's say 6 step policy. What's the difference between what I'm asking, what I'm telling it to do here versus what I'm doing here?
Now, because you have referencing off and you already have a chat in place, it's going to be pulling from this chat without essentially getting a bunch of new pointless information. Everything that you need to know about inserting IVs should be here within relative reason.
It's not going to talk about ultrasound with a pregnant person or something out of context from this conversation. It's just going to
Right. But if
reference
you,
this is the junk that we're talking about. Let's stay in line with this type of topic.
yeah, exactly. Now you're like, okay, I don't need any more references out of this. I'll turn that off. Now I can go ahead and ask about this 10-step policy. And it'll essentially just pull it from its own knowledge base existing and the previous chat. And you could ask a number of questions about any of these steps.
Wow. Well, there you go. That's what I'm talking about. No needle guide BS. Wow. It even has verification post insertion care. That's pretty slick.
And
All
so
right.
because
So,
it's in the non-referencing, it's going to
mm,
be a little bit more of like a secretary.